Being a first-time mom, everything was a whirlwind and had so many questions.
As young parents, we didn't think that it was going to be so expensive to have a baby.
You want to be able to provide for your kids and hope that they grow up strong and healthy.
My kids are benefiting from everything that WIC provides. It's definitely impacted our life.
It's kind of a game changer.
WIC first started in Texas in Montgomery County in 1974.
It was based off of a program out of Johns Hopkins that Dr. Page started.
There was a common problem, and that was food insecurity and poor growth. There was an urgency here that you had to do something.
It was really started as a formula voucher program, providing iron-fortified infant formula related to a high amount of anemia and malnutrition that was going on at that time. But over time, it's changed and become more of a breastfeeding program and a program focused on providing key foods with key nutrients for key stages of development, all the way from pregnancy to age 5.
We know that if we can provide those key nutrients and good education with those key nutrients, that we can really make a big difference in the trajectory for that child.
My daughter went into WIC for her screening and she had low iron. The people at the clinic, they were all super nice and gave me all the information of foods to encourage her to eat.
You're trying to do the best to get the nutrition for your kids. WIC has given us some peace of mind to know, okay, we're gonna have milk and cheese and vegetables and fruit and bread in the house.
When we get to the cash register, it's a huge relief to see that number drop after the WIC card goes in.
It's well documented that breastfeeding is really good for baby, it's really good for mom, and WIC has a track record of increasing breastfeeding rates.
We've got a lot of different ways that we can provide breastfeeding support, from our lactation consultants to our breastfeeding peer counselors to our 24/7 hotline.
The breastfeeding peer counselor that helped me, she knew how hard it was. It was amazing to have somebody understand exactly what I was going through.
Our WIC office, they're very helpful. I always left feeling heard and taken care of.
We love serving WIC moms. We love taking care of our little ones because we get it. In Texas WIC, we are making a difference. I see it every day.
The growth of the WIC program and what Texas has accomplished over the years is really extraordinary.
The WIC program in Texas has served over 21 million women, infants, and children in the last 50 years.
When I think about the value of this program, there's no program that has a greater impact on the health of individuals in Texas than WIC. We are in a unique position to be able to help moms at these key stages of infant development.
It's important that Texas WIC continues our innovative practices to always be looking for ways that we can increase our reach. Currently, we serve about 53% of the infants that are born in the state of Texas.
There's over 785,000 participants a month.
Participating in the WIC program, especially during pregnancy, improves health outcomes. It is associated with a decrease in low birth weight, the number of infants that need to use the NICU, and the percentage of moms that experience preterm birth.
It's our goal to make sure that every eligible family can participate and benefit from WIC.
Because we do believe every child deserves a healthy start.